is really responsible for working with employers to provide a safe work environment through our occupational clinics, where we offer the whole suite of products. And then we also offer a full suite of wellness programming, which addresses the physical, mental, social, and financial aspects for your employees. We do the biometric screenings, flu shots, lunch and learns, and we'll do population-specific programming as well. We also offer executive exams and wellness programs. And as a healthcare system, we're really uniquely positioned to partner with you and your selected insurance provider to offer access to our clinically integrated network and really manage your healthcare spend as an employer. Kind of a funny story, last November, we were approached by Bob Warmer to be the medical director for the Arnold Sports Festival. And what started out as us really being that mat side assistance for the athletes turned into us quickly having to develop and implementing a screening process for a very little known bug at the time called COVID-19. We successfully screened over 20,000 athletes, and through developing that screening process, we used those lessons learned to develop it for all of our local responders here in the greater Columbus area. We got that process really streamlined and scalable before the public even became aware of the need for screening their employees. We've worked very closely with Ohio Health and Ohio State to stand up the field hospital at the convention center. We had a little experience since we had been down there for the Arnold. And now we had to pivot and figure out how to help all of our clients reopen. We currently serve as the medical director for AEP, and we provide services for both the city, state, POTA, various manufacturing companies that are all considered essential. So we had the opportunity to work with companies at a very small scale of operation to fine tune some of the things, the services that we offer. In all of these conversations, we found numerous gaps. One of the gaps was all of a sudden people had to stop doing their core business and figure out how are they going to locate these newly needed items such as masks and hand sanitizer. How are they going to reconstruct their business environment to make it safe for employees to come back? And we also found that a lot of businesses, leaders really lacked having that subject matter expert to walk them through very specific things. There's a lot of information out there. It can be very overwhelming about what's right, and you can find things that are very conflicting. We figured out that if we provide direct access to a medical director, we can get clear and concise and actionable information that benefits the employer. So right now, I'd like to kind of turn this over to Dr. Wendorff and have him kind of walk through very high level things. I have a couple in my pocket questions to walk them through that have surfaced from other employer conversations. And please, at any time that anybody would like to jump in, please jump in. I do wanted to, let's see if I can find, I will find the website that you guys can go onto at Mount Carmel Employer Services that you could access all of our toolboxes. There's no cost for accessing this information. So Dr. Wendorff.
Yeah, thanks, Beth. And thanks for letting us come in and join you today. We're really excited about talking to really any employer in the area, in our community, that is ready to restart their business so that they can restart their business safely. And we want to be a partner with any of you to provide the services that are necessary. So, you know, when you're restarting or ramping up your business, you know, obviously there's several things that need to be done, and you know, Beth and her team have really put together a workbook that allows you to go through all of those processes. Everything from the first part of it, which is looking at your physical environment. Do you have the capability of your employees social distancing from each other and from the customers, if you have customers that are coming into your facility? From the physical layout to what is the right thing to do for your employees? How do you reach out to your employees and make sure that they're mentally ready to come back to work, that they're confident that the things that you're doing are going to keep them as safe as you can possibly keep them in a work environment? And then it's, you know, everything through how do you get your customers into the building? Are you going to wear masks? Do you need to wear masks? What are all the different things that need to be happening? And that's what Beth's put together. And as she said, if you go to the website that she's got displayed now, there's a place there where you can get information. And it just asks you for your name and an email address, and then you can look at all of the resource guides that are there. And these resource guides are not only things that Mount Carmel's put together, but link to Ohio and also links to the CDC recommendations. So on a high level, what we want to be is a trusted partner for you to, sorry about that, to get yourself up and running safely, because we want to make sure that every employee and every customer is as safe as we can possibly make them. So that's basically in a nutshell what we'd like to talk about today. And, I guess if I had to think of one thing to say to keep your business safe, is that we need to communicate, all of us need to communicate with our employees. The fact that you should consider, without being paranoid and discriminatory, you should consider that everyone that you meet may have COVID, may have the coronavirus in them, and be shedding virus at that time. And each and every one of us needs to do that with the understanding that that person could be me. And when you wear a mask, it's really not to protect you, it's to protect those around you. So wearing a mask is your way of saying to your fellow employees, I care about you, and I don't want you to get sick, and I don't want to be the one that makes you sick. And I'm also going to keep my distance from you, but I'm going to wear a mask in order to stop myself from infecting you. So I'm going to stop blathering on and ask if there's any questions that anyone would like to throw forward, because we'll field anything. And if I don't know, I'll tell you. Any questions?
Any questions from the group right now? Okay, well, we'll keep moving.
Okay. So
Dr.
Beth,
Wendorff, I have a question that surfaced a lot. Can you please explain the difference between a cloth mask and an N95 mask? And is it okay for me to just buy a box of N95 masks and use them for my employees?
So the difference between the cloth masks and the N95s is the N95s are specifically designed to protect the wearer. So a healthcare provider who wears an N95 mask, it's specifically fitted to their face, so there's no air that goes around the mask, so that when they're breathing in, if there's COVID in the air from a sneeze or a cough from a patient, that it doesn't get to the person wearing the mask. The N95's effect is to protect the wearer. The cloth mask effect is to protect those around you. So the cloth mask is not really designed to keep virus from getting to you if there's virus that is sneezed at you or things like that. It will stop some droplets, but it's not designed for that. What the reason to wear a cloth mask is to protect others around you, because if you sneeze or you cough or you talk and you're shedding virus, that cloth mask will decrease the amount of virus that goes from you into the 6 feet around you. So that's the difference. The question of should I buy N95 masks for my employees? The answer is, unless you're in a healthcare environment where you're going to be taking care of COVID patients, N95 is probably not what you should buy, not because it's a bad mask or it's going to cause any problem for your employee, but it's more than you probably need. And right now, N95s are in short supply, and we want to make sure that we have that supply for healthcare providers so they can use those masks in the places that they really need to be used. Right now, hospitals are taking their N95 masks, which are made to be disposable. They're putting them in boxes and sending them to Battelle to get them re-sterilized so that they can reuse them. And that's great that Battelle came up with that, but that's something that happened because we don't have enough masks. And if every employer starts using N95 masks, then the supply will go back down. And believe me, it sort of feels like people think this is over. This is not over. we are still in the midst of a worldwide pandemic that is very bad. And we need to make sure that we continue to do all the things that have gotten us to a point where we can talk about reopening our businesses.
Thank you. This was another question that we get a lot. As an employer, what are the things that I can have my employee do before they even come to work?
So for those on the phone, Beth did not give me these questions ahead of time, just so you know. And really it's very simple things. What you should ask your employees, what we are asking our employees to do is check your temperature at home before you come in. And if you don't have a thermometer, go ahead and try to get one. But if you don't have one, just assess your own wellness and go through the list of things that COVID causes, which is shortness of breath, cough, sneezing. Some of the more minor symptoms are fatigue, nausea, diarrhea. Those are less likely, but if you don't have a fever, you probably don't have COVID, but it's not an absolute. So you assess yourself for those symptoms, especially with a temperature check. And if I would advise that many of you, if you go to the CDC website, they have a symptom checker that you can click on, and it basically goes through that list of things. And I think, Beth, don't we have something like that as well?
Yes, it's also accessible from our website.
Okay. Yeah. So if each morning your colleagues or your employees just go to that site, click through the few questions, and the app will say you're good to go. Go to work, and then you can decide if you want to have temperature checking at your place of business. The recommendation is that you limit access to one or two entrances. If you have customers, that you limit their access and try to get workflows or flowing through your practice in a one-way direction, exiting through a different door. All of those things are designed to help us with social distancing, because that right now social distancing is the bullet. There is no silver bullet, but one of the big bullets in our holster right now is social distancing. That is what has worked and kept us where we are now, which is at a place where we're not at this point overwhelming our medical system. As Beth said, we set up a 1,000-bed hospital at the convention center, and those beds have sat there empty because we didn't have to activate that. And I believe at some point in time here shortly, they're talking about breaking those back down, because the expectation is that we won't need them. But as with everything with COVID-19, everything changes on an almost hourly or daily basis. The things that I'm telling you today, keep checking the CDC website. It may be that tomorrow the things change. Just as an example, if you look at the CDC website on whether your employees can come back to work, when they can come back to work, if an employee has symptoms, the current recommendation from CDC is that they self-quarantine at home. If they don't have severe symptoms, they don't need a test. They just go ahead and self-quarantine, and then they can come back to work when two things are in effect. One is that they've been symptom-free for 3 straight days without taking something to decrease their temperature, and it's been 10 days since the onset of their symptoms. Now that's an employee who's been exposed to someone who has noted to have COVID-19 but has no symptoms. The current recommendation is that they go home for 14 days. So the guy with the symptoms is okay to come back in 10 days. The asymptomatic employee is supposed to self-quarantine for 14. I believe some of those things are going to be changed. These are the kind of things that change on a daily basis. And the CDC is working very hard to make sure that their recommendations keep everyone safe.
Dr. Wendorff, do you have some idea on, there was a piece of legislation at the federal level talking about the liability for employers. And have you have opinion or tracking any of that? And again, what will happen at the state of Ohio? Have you heard anything at that level?
We have an advocacy arm here at Mount Carmel, and they're keeping a close eye on that, and they're in constant communication with the state government. We have advocacy at the Trinity level, at the national level as well. The answer to that question is I don't know. I believe that at some point in time there will be some sort of legal relief provided so that employers can be comfortable with if you follow the CDC guidelines that you're going to be held essentially harmless if an employee does come and gets and catches COVID at your site. When we talk about the things that we talk about for the employers, and we talk about, well, when this happens, when that happens, it is really when, not if. If you have enough employees, someone's going to catch this bug. This is a very contagious bug. The CDC put out an infographic last week that showed that there was a choir practice with 40 people in the choir. One had symptomatic COVID, and they tested the whole choir, and 32 of the other choir members had been infected by that one episode. It is a very contagious bug. So it's really it's almost, and it's a great question, Janet. I can't imagine that they're not going to give legal relief for that, as long as you follow the CDC and the Ohio recommendations.
And I do think that's important for all of our businesses to know that they should have a plan, and whether it follows CDC or the Mount Carmel's guidelines. I mean, there's several out there, and we'll be putting out suggestions as well. But to make sure that's documented. So if something like that would happen, you have proof that you've done everything in honesty and upfront. And,
yes,
can they 100% prove that they got it at that place of work? I don't know if you can always do that. But I do think it'll be very good to have our employers feel some sense of security. And I guess the employees, too, to build some confidence there that there is everything in place in my business before I go back.
Right.
Yeah. Thank you.
So one of the other things that we've heard from employers is, we have some employers come to us and say, hey, you guys are testing. We want to test everybody. We want a clean slate when we reopen. We want to have every colleague tested, and we're only going to let the ones that are negative come into the facility. So in a perfect world, that would be great. If we had unlimited tests and the tests could be done in a few hours, that would be great. You would be able to test everybody, would have absolutely clean slate. The problem is that we're not in that world now. The tests that are done, and we're talking about the swab test, not the blood test. The blood test, our position at Mount Carmel, and I think in many of the the organizations, healthcare organizations would say the same. We're not confident with the blood test yet. It does measure antibodies. No one's absolutely sure that having the antibody makes you immune, and nobody is really sure about the sensitivity and specificity or the ability to diagnose from the blood test. So if you talk about the swab test, the test takes up 2 days to come back. If you tested everyone today and you had someone who was pre-symptomatic, you test them today, their test comes back negative. By the time they hit your floors, they're shedding virus. So what we don't want is for employers to have a false sense of security that is obtained by doing universal testing. Now that's rightly, it's difficult to get that message around when you hear on the media every day, well, we can't open our businesses until we have more testing. Well, and then I'm telling you, well, don't test everybody. The idea of testing is to test symptomatic patients, get them diagnosed, then do the contact evaluation, and then quarantine those that they came in close contact with. And when you see that close contact, what that means is within 6 feet for a prolonged period of time is how the CDC states that. And most people think that's 15 to 20 minutes minimum. If you're working in the 6 foot area with a coworker for 15, 20 minutes, and then they come down with COVID, you're considered a close contact, even if you were both wearing masks, because again, the masks are not perfect. The masks are helpful for those that you come in contact with, but that does not negate the close contact concern. So we want to keep people 6 feet apart at least, and you want to do that on a regular basis. But if you hear somebody, Joe got diagnosed with COVID, I walked past him in the hall yesterday, so should I quarantine? The answer is no. It's close contact for a prolonged period of time.
Any other questions for the doctor or for Beth? Okay, we'll continue on.
I have another question that pops up, and this isn't really so much about the physical health. What should I do as an employer to address the emotional well-being of my employees during this? What should I be aware of?
They're fine. No, so I mean, it's a great question, Beth, and it comes down to, caring about your employees and getting that education out to your employees, letting your employees know that you have a plan and that you are going to take the steps necessary to keep them as safe as you can possibly keep them. It's let them know about your plan, and then find out if they need additional services. Isolation is a huge risk factor for all of us, and being at home alone for people is difficult. There's many studies that show social isolation is a very high risk factor for having worsening of a disease that you already have, or getting a disease that you didn't have. So I think it's, what you want to do is reach out to your colleagues, make sure that they understand that there's help available. Beth's team, I mean, we have behavioral health specialists that can help with this. I know all of your employees have, employee assistance plans that can help with these things. But behavioral health aspects are very important, as well as the physical aspect of being sure that, that they come in with a mask and that they do the social distancing.
Thank you. One other thing that I would like you to talk about, Dr. Wendorff, is the importance of healthcare outside of the COVID, meaning I have pre-existing conditions.
Yep.
I might have diabetes. I might have a heart issue, heart fluttering that just started, and normally I would go get that checked, but now sure. I'm waiting. Have you seen any impact of that?
So absolutely, and we started seeing this in Italy, where their death rate from non-COVID started to decline because of COVID. Now that's medical system was overwhelmed. In Franklin County, thankfully, our medical systems are not overwhelmed with COVID. We still have ICU beds, we still have ventilators, we have what we need. But what has happened is that people are scared and they don't want to go to the emergency room. One of our doctors here at Mount Carmel, Christy Slam, is a general surgeon, and she shared with me she's never seen as bad a gallbladder disease that when she's operating as she has during this COVID, because people will wait 3, 4, 5 days later than they should. And then by the time they come in with a hot gallbladder, instead of being able to take their gallbladder out with a laparoscope, she's having to go to an open procedure and then in the hospital 2 or 3 more days, and they've got gangrene of the gallbladder. And that's just one example. We're seeing this over and over again. We're hearing stories of patients who have actually passed away because they just ignored the chest pain that they knew they shouldn't, but and if in a pre-COVID world would have gone to the emergency room or called 911. So we want to make sure that when we take care of our patients, that we let them have that message, pass along the message. If you need the care, it's there and it's safe. The hospitals are separating COVID suspicious patients from non-COVID suspicious patients. They have special units where the COVID patients are being cared for to try to keep clean the other, clean a relative term, non-COVID in the other parts of the hospital. So they're doing all the things necessary to keep those patients safe. And then all of the healthcare providers in town are providing telemedicine for those patients that need to have an evaluation, need to talk to their doctor, but don't want to physically go in and face them face to face or go to the emergency room. But it's very important, and I think Governor DeWine and Dr. Acton have been beating that drum for the last several weeks of, don't not go to the emergency room because of COVID. You need to go ahead and take care of yourself, because we are seeing an increase in the non-COVID associated death rate throughout the United States, and especially in Franklin County.
Thank you. Are there any questions?
So I have a question for those on the phone. What are you all seeing out in the community? I guess this is Thursday. We've been open since Tuesday. I've heard people say nobody's shopping. Is there anyone on the phone who has a business that involves customers? Can you share how your customers are feeling and whether they're coming?
I don't know if anybody has a retail business that's on the call.
Okay.
I will say that from some of our retailers, I do know that there's probably about 50% right in the uptown area that are not choosing to open this week. In fact, they're waiting till June. And some of the ones that are open now or are opening this weekend, they have put together clear standards and they're putting them on their window. And then, of course, they're training their staff, and they are not requiring masks, but many of them are suggesting that people honor that and wear masks when they're in the store. They're limiting the number of people in their stores, asking for limited touching of items. But that's the main thing that I know. I haven't heard a lot of people out shopping either, other than grocery shopping right now. I don't know if others, even your own, have any of you that are on the call gone out to a retail store in the last 2 days? Suzanne, have you done anything like that? You're on mute, just so.
Yeah. So I haven't in the last 2 days, but I've gone to the grocery store, and there more than half of the people are wearing a mask and gloves and, following the social distancing. Costco is like, oh my goodness, they have it so that you have to go like a quarter mile down to pick up a grocery cart to get to the front door that you just went by. But that's good for social distancing, right? So.
Yeah.
And I know like the florists and that, they are doing drive-by pickup. So you order online. So like Fort Myers, I'm picking up a couple flats of flowers from them on Friday, but you have a specific appointment time to drive in and get your flowers.
Oh, that's good to know.
Yeah.
Anybody else?
It's going to be go ahead.
I was just asking if Mike or Emmanuel or Stephen, does anybody have any thoughts? Have you been out and about yet? Or any of the people, your customers? Nope. Okay. Sorry to interrupt.
Part of our tool set, what we've been able to do is we've reached out to local vendors in the community. There's a marketing company that's there that's able to get cloth masks in pretty quickly. Watershed Distillery has switched all of their distillery over to hand sanitizer, and you're able to get that for $35 a gallon. We also, it's very interesting in talking to organizations about the difference between cleaning and disinfecting and the pace that needs to happen. And not only the pace, but what that includes, because there's a difference between that disinfecting and sanitizing and how often that needs to be done based on your layout, how many people are in and out. And even if you're in an environment where it's not a retail environment, if you've got a lot of deliveries that are happening or a lot of business meetings that are happening, that kind of puts you in a different environment as far as what it is that you need to supply. So there's a couple of organizations that are janitorial oriented that are on that vendor list as well. Ideally, when we first started this whole product line, we wanted to be able to walk into an organization and make the information accessible to anybody for no fee, be able to go in and consult with anybody that would need a consultant, and then also be able to do the ground level tactical work for them should they decide. Like for instance, with CODA, we're working with them to actually do the temperature screening, the monitoring of their employees before they start their shifts. So it's really all about filling in the gap of where it is. And if you don't have those resources, we kind of talked about, if you're a smaller organization and you need to supply certain things for your employees, but you don't have the access to the resources to get that, there's plenty of community access. Mount Carmel is kind of we're the Catholic organization in town. We're the little kid on the block. We do that outreach. We're very well connected in the community to provide that outreach. And it's a little overwhelming with the amount of people who are finding themselves in a position. 1 in 4 people now have lost their jobs. So there's a whole other element that we're going to have to figure out how to deal with, just even from a business standpoint. But we have those resources available. We encourage you to reach out to us. Come on, there's got to be a question that hasn't been covered yet. Somebody's got something.
I'll add that the chamber document that should be out by tomorrow does have sourcing of PPE locally. So where you could get masks, certainly not the big ones that the doctor talked about, but the material ones and paper ones. But the only thing that I don't have a source for right now is, do you know what, if someone did get COVID and then you had to do the real deep cleaning that they're talking about that should happen to your office, like a regular cleaning company doesn't always do that. So I didn't know if you knew of anybody.
Yes, and actually, if you go onto our tool site and put in your information, you'll have access to the 3 local area vendors that have been vetted for their level of sanitation.
Okay, thank you.
Dr. Wendorff, can you talk a little bit about testing and how that whole process works? I don't know if anybody on the call has actually gone through the testing process. What could I expect if I wake up in the morning and I have a fever, I feel like I need to go get a test, or I need some kind of access to my primary care physician and he tells me to go get tested. What does that look like, and where are these tests happening?
Yeah, so to start with, as you correctly said, if you wake up with a fever and symptoms, if they're severe, if there's a severe shortness of breath, you can't catch your breath, call 911. They all know how to do this. They will safely transport you to the closest emergency room. If you have a fever but you're not extremely short of breath, you think maybe I can handle this at home, call your physician. Your physician will probably want to do a telemedicine visit. But at this point in time, the testing that is being done at our test stations, which are located in close proximity to our 4 hospitals. So there's one in New Albany, one in Grove City, one by St. Anne's, and one at the CSC, the Corporate Services Center, which is across from Mount Carmel East. Those are our 4 centers. They're open 7 days a week. They are open for testing patients who have a prescription faxed in from their provider. And the providers are being asked to appropriately screen the patients. So at this point in time, this is not for asymptomatic patients, it's for symptomatic patients. The only asymptomatic patients that are currently being tested now for Mount Carmel are patients who have planned surgeries. So before they go to surgery, an asymptomatic patient is tested to make sure that at that point in time they're negative before they have their surgery. So if you wake up with symptoms and you think you might have the COVID, you talk to your doctor. The doctor will then determine whether your symptoms are of a severity where they really need to know whether this is COVID or not. The doctor may say, well, it sounds like COVID, but you probably don't need a test because we're just going to isolate you anyway. So you can just go ahead and stay at home. And that's where the CDC guideline comes in as well. Well, when can you go back to work? And the answer is 10 days from the start of your symptoms and 3 straight days of no symptoms both of those need to be, so it's at least 10 days, and it may be longer depending on how long your symptoms last. Now, if your symptoms last 7 days and your doc told you to just stay at home, you probably ought to be calling them back for a follow-up and say, I've still got symptoms 7 days later. You know, you didn't test me before. I'm feeling a little concerned. But, you know, as with everything we've talked about, assume that you have virus anyway, whether you're symptomatic or asymptomatic. But the testing, you know, basically you'll drive up, stay in your car. A healthcare worker will approach you with a swab that goes up the nose into the nasal pharynx. It is not fun to have somebody shove that up your nose. This is not something you want to do on a Friday night for kicks. And then that swab will go to one of several potential testing sites at Mount Carmel. We have reagent that allows us to do tests that are back within 2 to 4 hours. Those are the tests that are being used in the emergency room, and those are the tests that are being used for the asymptomatic patients, so that when they go to surgery, we know that they have been negative within the last 24 hours and not waiting 2 days. The other swabs are sent to a vendor that we're using in Michigan that has about a 2-day turnaround time. You know, early on in this, you may have heard horror stories of people getting tested and they didn't get their test back for 10 to 14 days. That is correct. That's how it was. But we've passed that now. So now the tests come back in 2-3 days at the maximum. Did that answer your question, Beth? Is that what you're thinking of?
Dr. Wendorff, I keep hearing in the news of things called high risk and pre-existing conditions. How can I use that information to communicate to my employees?
Yeah,
who should take a little bit more caution?
You know, and I'm glad you brought that one up, because I did want to talk about this. You know, the definitions are important. And when we talk about high risk patients, there's really two different definitions we're talking about. We're talking about high risk of catching the disease is one thing. High risk of having a bad outcome if you catch the disease is what most people have heard about. So when we talk about the high risk population, this is a population that it's not any more likely to catch the disease than anyone else, but when they catch it, they have a bad outcome. And that includes age over 65, which I think is wrong. We can't use that. I just turned 65 this year. I'm not a high risk. I don't believe it. But it is a high risk. Okay, so age over 65 or chronic diseases or immunosuppression. So a patient who's had a kidney transplant is on immunosuppressant drugs to stop rejection of the kidney. That makes them at higher risk when they catch this. Now that is a group that is in both buckets. Immunosuppressed patients are also more likely to catch the disease. Also more likely to catch the disease are patients or people who must live in close proximity to others. And there we're talking about nursing home patients who also were in both buckets, and prisoners, some of whom are in both buckets and some who are only in that first bucket, where they're more likely to catch it, but a lot of them are young, healthy people, and when they catch it, they don't have a higher risk of a bad outcome. But nursing home patients, you know, I saw a statistic this morning in Ohio, 22% of the Ohio COVID deaths have been patients who came from nursing homes, which is not unexpected. That's a population that when they get any illness, they're more likely to have a bad outcome. When they get the flu, they have a worse outcome. They're also going to have that for COVID. You know, what has been nice to see with COVID is it's very rarely being a problem for children. So you know, that's a silver lining, I guess. But those are the things with the high risk is, you know, chronic diseases makes you at higher risk of having a potentially bad outcome, and age. Those are the major two.
And Dr. Wendorff, there's a question in our chat box that what if you don't have a primary care physician? And
Yes,
the question before you were referencing, you know, go to your primary care doc.
Sure. So there are many telemedicine applications now that you can use if you don't have a primary care physician. Many of the insurance plans have a teledoc capability. I know Aetna does. I believe Anthem does as well. So you can look through your insurance company. Mount Carmel Medical Group, I have to mention them. They have telemedicine capabilities, and you can find that on the Mount Carmel Medical Group website for new patients as well as established patients. So you can talk to a doctor in telemedicine even if you don't have a primary care physician. And the urgent cares, most urgent cares are still open too, and many of those are acting as what's called fever clinics, which means these are clinics that primary care providers who have a patient who calls with fever, they don't want them to come to their office. They don't want to do a telemedicine visit. They'll send them to this urgent care fever clinic, which stands for fever and upper respiratory ailment, fever.
Thank you.
Okay, so let me highlight. So what we know is we're not done with this pandemic yet. What we know is that it's transfers very quickly in tight spaces. What we know is that as an employer, trying to set that baseline of expectation of behavior change at the very beginning and being strict is going to encourage compliance down the line. I'm sure if everybody thinks about the 15th and 20th of March, how many times you were washing your hands and how long you were washing your hands, that's probably fallen off since then. So out the gate, those requirements need to be pretty tight. We know that you need to encourage your employees if they're not feeling well in the morning to please not come into work, figure out a way to screen them, try and encourage them to get medical attention if they are having difficulty breathing. If they're having any other kind of medical issues, encourage them to continue to seek out their maintenance for their primary care physicians. Temperature taking is one way of screening. Doing the check of questions of symptoms is another way. Pretending, I think, the most aha moment is behaving as if you have COVID and behaving as if everybody else around you has it. Kind of puts that in the forefront of awareness of how closely you are with people, protecting your airways, keeping everything clean in your personal space and distancing. We have on the Mount Carmel Employer Services website a toolkit for you. It is free and accessible at any time, downloadable. We absolutely encourage lots of new signage, encouraging the behaviors that you'd like to be modeled by your employees. Is there anything I'm missing, Dr. Wendorff?
No, I think the only other thing I would say is that just to reemphasize, people, it seems to me, react adversely when they're told what they have to do. When you're talking about somebody wearing a mask into your employees or your customers, I think it should more be a thank you. Thank you for wearing a mask, because when you wear a mask, you're telling me that you care about me. And I think that's an important distinction, rather than saying you got to put on a mask because I want you to. That's your way of telling me that you care about others. And I think, the more we get that message out, the more people are just going to wear a mask because they want to and because they do care.
Great, thank you.
We have another question from our chat box that
Yeah.
Has Ohio had any children with COVID that are showing the heart issue?
Not that I'm aware of, and I have been watching that fairly closely. I will admit I did not review the site this morning to look for that data, but and I believe the chatter is talking about the unusual manifestation in children that they've seen half a dozen or more cases in New York City. It's all of the patients seem to have COVID. They're not sure if COVID is the cause. That is a real concern, obviously, in the pediatric population. I'm not aware of any Ohio cases at this point. I know there have been several cases in New York. That's where it was first noticed, and I believe there was a case or two in Georgia, but don't quote me on that. As far as I know, there's no cases in Ohio.
All right. Thank you.
Mm-hmm.
Okay, any other questions? All right, fantastic. Well, thank you all for your time.
Thank you for your time.
Thank you, everyone, for coming to your coffee and conversation. I hope you enjoyed your coffee or your tea that you had with you this morning. And Dr. Wendorff and Beth, thank you very much for your time and expertise. And we remind everybody that next week, our coffee and conversation on Tuesday, the May 19th, will be motivating employees through the next phase of COVID-19 with Lisa from Change for Growth and Kelly from Champion Companies. And they'll be talking about what they've done and their best practices. And then at lunch on Wednesday, our Lunch and Learn will be a feature on our health insurance program through SACA. And it will be the benefit that we have, which is 2 or more employees. But we also have a new plan that we're introducing for the solopreneur, the single person that's in a business. It can't be 2 people and just one wants it, but it's actually the person that's an entrepreneur on their own. We do have a new insurance product, and it's being quoted now, and it'll go into effect in July. So we will be talking to some agents about that plan. So if you know of anybody and your customers that might be interested in some insurance products, you might want to send them our way for, it's at noon on the 20th, May 20th. So everyone have a wonderful day and stay safe. And don't forget to visit the Mount Carmel website so you can get some of those best practices that they were referencing. Take care.
Thank you.
you.
Bye. Thanks.
Bye.